really excited to have you all here tonight. We've got a great turnout, and we've got some great panelists that we're going to be hearing from here in just a few moments. We're going to start off with doing one of my favorite things to do in these online webinars, which is to introduce my father and fellow co-founder of Dakotans for Health, Rick Weiland. Dad, why don't you take it away here and get us started?
All right. Thanks, Adam. And again, thanks to everyone for joining us tonight. This is our third in a series of webinars to educate and hopefully motivate folks.
Hey, Dad, it looks like your computer might be on mute.
PC, you'll notice that.
Oh no, I can hear you. Sorry, never mind.
Can you all hear me? Yeah. Okay.
Yeah.
Yeah. So anyway, yeah, it's the third in the series. We've got several more lined up as we continue to try to educate folks who are interested in doing something about healthcare access and ultimately outcomes. I'm really excited to have our two distinguished guests from North Dakota, Earl Pomeroy, who I've known for a long, long time, all the way back to the days of the Grand Forks flood, when I was the FEMA director. And Mary, who I've gotten to know in the last few years, who's just a firebrand when it comes to healthcare, a real passion, and obviously a policy expert. So we're great to have them both. I want you all to just take this all in and hopefully come out of this better educated and motivated to help us get this thing done. As many of you know, South Dakota is one of 12 remaining states that has refused to expand Medicaid, and we're surrounded by states, including our cousin to the north, North Dakota, Montana, Nebraska, Minnesota. The only outlier right now would be Wyoming. And I'm hoping we can beat them to the finish line in getting this done. Just this past July, two states, July and in August, the states of Oklahoma and Missouri actually passed constitutional amendments through the ballot initiative process to expand Medicaid. Obviously, those states are also very conservative, but this has really become a dinner table issue, I think, that is affecting almost everyone at some level. People we know, friends, family, relatives, neighbors who are dealing with this problem of having access to affordable health care. It is obviously, since 2010, the Affordable Care Act was passed, and since then, 38 states have expanded Medicaid. South Dakota, as we estimate the amount of federal support we would have received, has left literally billions of dollars on the table. And obviously, people have died as a result, and obviously people have gotten sicker. And fortunately, there's just been a complete lack of leadership at all levels in South Dakota to get this done. There was an effort in 2017 by then Governor Dennis Dugard to pass Medicaid expansion in the legislature. And I know a lot of us were very excited that he was taking this up in his last year. And unfortunately, he couldn't get the support of his legislature to get it done. And that's been the only real effort, serious effort, to bring health insurance to many people who are currently uninsured through really no fault of their own. We have on the streets today an approved constitutional amendment ballot measure that would, according to our bipartisan Legislative Research Council, would bring healthcare coverage to over 40,000 South Dakotans, with federal support in the first year of implementation of around $308 million a year at a cost to the state of up to $20 million. And you do the math. If you need a calculator, that's fine, but we will do the work for you. It's about a 15-to-1 return on investment. By all standards, it just seems like a no-brainer, and it's just so unfortunate. We're sitting here as one of 12 states that have yet to get this done for the people of South Dakota. We're going to need to collect over 60-some thousand signatures, raw signatures, to get that magic number of about 36,000 valid signatures to qualify this for the 2022 ballot. We have been, frankly, kind of overwhelmed with the organic passion and support for this campaign. We have now over 500 people who have signed up to work in the campaign. And we have over 125 people right now getting signatures within their social networks, their neighbors, their friends, their family, their colleagues. And it's a really exciting time to see that kind of grassroots support for something that we think is so critical. There are numerous studies that have been done on Medicaid expansion in other states, pointing to the positive results, both in terms of coverage, health outcomes, and economic impacts. And we're going to hear about our sister state to the north on how they got it done up there and what it's meant to the people of North Dakota. We're going to hear their stories, their trials and tribulations, and their expertise, which I hope will be not only informational, but motivational as we continue to move forward. We will ultimately get this done. It's going to take a lot of hard work and a lot of grassroots support, and we need your help. We will have a paid effort to complement what we do with our volunteers, but for every signature our volunteers get, it's one less we have to pay for, and those resources can then be turned to running a competitive campaign in 2022. That being said, I'm going to turn it back to my son, Adam.
Hey, well, thank you for those thoughtful and concise comments. We're just going to move things along here. So our first speaker needs no introduction in the healthcare, health policy, and legislative community and the Dakota community. Earl Pomeroy is one of the great legislators and healthcare activists of the Midwest and formerly of the United States Congress. Earl is a citizen legislator who served a number of years at the State House before being elected insurance commissioner of North Dakota, a post he was reelected to before entering the United States Congress, where he served 18 years as the lone congressman of North Dakota. Incredibly storied and interesting career, and we're very lucky to have him. Earl was a key architect of the Affordable Care Act. He was a senior and influential member on the House Ways and Means Committee. He knows a thing or two about healthcare. He knows a thing or two about North and South Dakota, and he knows a thing or two about health insurance. So Earl, I'm going to turn it over to you. We're incredibly honored to have you here. Take it away.
Adam, thank you very much. We're going to talk about storied political leaders. South Dakota has got such a rich history of people that have meant so much to me. My first race was working for George McGovern in that 1972 campaign. And how I enjoyed during my congressional years, the time I had with Tim Johnson in the House before he went to the Senate. And of course, Tom Daschle was such a good friend to all of us, continues to be the closest personal friend to the two senators with whom I served, Conrad and Dorgan. So this was really, we had an awful lot of fun together, and we hopefully did some good. And one of the things that we got to do during these years was get together with like-minded people and talk about how we could try and make things better. And that's how I view this opportunity tonight. I'm just thrilled that you asked me to participate, and really appreciate each and every one of you taking a bit of time to be with us. 40 years ago, I was in my very first days of as a newly minted state legislator in North Dakota. We had 27 out of 100 in the House. We had 10 out of 50 in the Senate. And I never would believe we'd be looking back at those numbers as the good old days for partisan balance, but that's where we are. The Democratic Party has collapsed into place like it has in other parts of rural America. Just a reality. We can sit around and mope about it, or we can try and find creative ways to try and still advance policies which help people. There's a lot of areas, even in this god-awful partisan week that we're in, where we literally saw the ransacking of the Capitol, a disgraceful moment for our country. But even in this low moment, I am convinced there's more that people care about. If we get the politicians out of the way, and they can move forward together, making progress as a nation, and in our case, in the Plain States. A couple of areas where, even being one of a small minority in the House 40 years ago, I realized where we had our differences. We differed on how much we wanted to spend for the schools. We differed on how much we wanted to tax the energy companies. But my gosh, there was a lot we agreed on too. Generally, when it came to disease, but we were against disease. Bipartisan, Republican, Democrat, we didn't like disease. Federal money. My God, that is something we liked. And so Republican, Democrat, we like federal money. No on disease, yes on federal money. It's kind of a head scratching thing to look at politics nowadays. You look at the failure of our Dakotas to take the kind of preventive measures that could have been taken to have made dramatically improved COVID outcomes. It almost looks like, well, what the hell? Are we for disease now? And with South Dakota's opposition, steadfast opposition to expanding that Medicaid, which is 90% cost share federal to state, 10% on a dollar, you get that kind of money back. Your own study shows a 15 to 1 return on investment. Have we moved to for disease and against federal money? Is this how this thing has evolved? Well, I do think it's extraordinary and kind of overstated as these observations are. There's some truth to them. And it just goes to show that people have gotten so wrapped around the partisan axle, God, we can't even see straight anymore. And so what happened with, why were we against the federal money in Medicaid? Well, it all comes back to the fact that Medicaid expansion was provided in the Affordable Care Act. The Affordable Care Act became known as Obamacare. Anything Obama did was bad. And as Republican-led states figured out how to resist this, they first decided those exchanges that were part of the act where people can buy the subsidized coverage, we're not going to do it. We're not going to do it at a state level. That was fine because in the law we had written in if states don't do it, the federal government does. So South Dakota, North Dakota, we don't have state exchanges, but people can buy their coverage. Medicaid. Well, we had a little bit of a coercive element in the bill for Medicaid. So you don't have to expand Medicaid, you don't want to. But if you don't, we'll take away all Medicaid match on other stuff. And ultimately, that was such a coercive play, such a heavy hand in the bill that Justice Roberts said, too far. That's coercive, and you can't do it. So that fell out. Well, before the Republican memo got out, North Dakota went ahead and they passed Medicaid expansion. They passed it overwhelmingly in an overwhelming Republican legislature led by a Republican governor because it just seemed to make so much sense. But the politics of this healthcare deal, Obamacare, hating everything about Affordable Care Act, that spun up. And so a state like South Dakota, a little behind on the legislative pipeline, didn't get it done and has had to suffer ever since with this kind of Republican luck. No federal dollars back to us, please. Don't you dare send us no federal dollars to help our people get coverage they need. That has been the lock, but there's been a way to pick the lock. It is, let's just bring this to the people. Let's take this tired old legislative debate, put it aside. We're going to take it right to the people, see what they say. Had been tried some other places, Nebraska, Idaho, Utah, Oklahoma, Missouri. These are, as you'll identify, rock-ribbed Republican places. And the voters, when left with the choice, they voted for it. Because to them, it wasn't about Obama. It wasn't about some big partisan fight. It was about, can we help more of our people have the coverage they need? And if you got people that can pay for their health care with this new Medicaid part, won't that keep the hospital open for when my family needs it? And basically getting the politics out and just the common sense of it in front of people, this has worked. And that's why we are so excited about this petition effort launched in South Dakota. I'm telling you right now, South Dakota, I don't mean to be, I mean no disrespect for our southern neighbor. We have a lot of fun with our interstate business, but I mean no disrespect when I say South Dakota is being played for suckers. You've got other states, including, you're like the hole in the donut, you in Wyoming, who the heck wants to be linked with Wyoming, relative to not getting this federal support to get more people covered for health care. Iowa, North Dakota, mentioned Nebraska, Oklahoma, Missouri, all around you. And what are we getting for it? Well, North Dakota, we're getting a very substantial, we think it's maybe a 24-to-1 return on equity, return on investment in North Dakota. So powerful that when the last legislature convened, the Medicaid bill had to be reauthorized. It had to be passed again. And the number one issue for doctors and hospitals in North Dakota was making sure that Medicaid expansion got passed. Why? Because it was no longer about politics. It was about healthcare and the dollars that we need to keep our healthcare infrastructure strong. So that's what's at stake, and that's the opportunity we have with these petitions. We're going to get the politics out. We're going to go talk to people about their healthcare and what they want for South Dakota, a place with federal dollars supporting the healthcare infrastructure all families need, Medicaid or non-Medicaid. We're going to talk about making sure that in the time of COVID, people have coverage. Goodness knows we got COVID. We don't have coverage, we need coverage. And so it's really a very, very critical moment in the state's history to take a look at this question. And every one of you being involved in this petition effort, I just couldn't thank you enough. Adam, that concludes my part. Am I introducing Mary or are you introducing Mary?
You know, we fought over it, Mary, and I ended up deferring to Earl because he's just so good. So Earl, I think, please, the honor is yours.
Thank you. Well, you're just such a young whippersnapper. Mary and I have been on this healthcare deal longer than you've been alive. So I think that's how I ended up with the assignment. Mary and I are friends from college. When I was in Congress, she was Senator Kent Conrad's chief of staff. She has taken her PhD in nursing, where she was a faculty member at the University of North Dakota, director of the Center for Rural Health, and was perfectly situated for Majority Leader Tom Daschle to help us advance Mary into a senior post within Health and Human Services. She did so outstandingly well in that senior post. By the time she was done, she was acting deputy secretary, number 2 in the largest agency of the federal government relative to the flow of dollars, Health and Human Services. This is my college pal, Mary Wakefield. I couldn't be more proud of her. And she's a very significant national leader. I know that she's going to bring a little more technical and a little more dollars and cents to the discussion as a very important part of our presentation tonight. Mary?
Thanks a lot, Earl. It's a pleasure to be with you and to be with the Wylands and to be with our colleagues in South Dakota. Hi, everyone. It's my pleasure to talk with you and continue the conversation about Medicaid expansion. Before I do that, I just want to say that when Adam Wyland asked me if I'd be willing to participate in this evening's program, I of course said yes. And I said yes because I've been to South Dakota many times, and I have warm recollections of those brief stops in your fine state, including an early experience in South Dakota when I was in my 20s and I was pulled over for speeding by one of your state's finest. On that day, I was on my way to graduate school, not in South Dakota, but in Austin, Texas. So I clearly had many miles to go. My foot was apparently a little bit heavy on the pedal. But in my defense, that was before cars had cruise control. What I don't recall about that experience was the amount of the fine that your law enforcement officer gave me that day. But you know what stayed with me? He was awfully nice about it. It was just fine South Dakota hospitality that he served that fine up with. And I've never forgotten it to this day. So that was one of my early South Dakota experiences. When Adam asked me to participate tonight, I, of course, said yes. But talking about South Dakota hospitality, that is not tonight's story, of course. This is a different story we're talking about telling this evening about South Dakota. And it is, of course, about how to ensure that all South Dakotans have a fair shot at being healthy. And to talk, as Earl did, about one important program that can really help to advance that agenda, that can help to achieve that goal. And that is, as we've been discussing, Medicaid expansion. For me, here in North Dakota, one of the first times I saw how big a problem it is when people do not have access to health insurance. When I first saw that really vividly was over 20 years ago now. And that was when I was the director of the Center for Rural Health at the University of North Dakota. At that center, part of our work was to go out across the state of North Dakota to hold community meetings in small North Dakota towns in order to better understand the challenges that rural communities were facing when it came to healthcare. And then what we would do is we'd go back to our offices and figure out what we could perhaps do about those challenges, how we might be able to partner with those rural communities. Well, at one of those community meetings, a woman, probably in her early 30s roughly, came up to me after folks were leaving the meeting. And she came to me to tell me her story and also to ask me a question. Her story was this. She was a single mom with a couple of young children. She had a full-time job in that small town, but she had no job-related health insurance. And she could not begin to afford the cost of buying health coverage because she had a serious health condition, and those insurance companies that did not refuse to insure her, those that didn't refuse to insure her, would only offer her coverage with sky-high price tags. I recall clearly that day that she had tears in her eyes while she was saying all of this. Well, she was saying to me that all she wanted to do was to keep her job and to care for her kids. But she could not afford to go see her doctor when she knew she needed to. And so she was afraid that there would come a time when she would lose both, her job and maybe even her children. She asked me, was there something that I could recommend to her, something that I could do to help her? I can tell you, as a nurse, there are only a few times in my career when I felt like there was nothing that I could do to help someone else. It seemed like as a nurse, I could always do something. There was always something that could be done to help somebody get healthy or to stay healthy, to help someone else alleviate pain, always something. But you know what? This was one of those awful times when, as I listened to her story, what I felt was that there was nothing that I could do, nothing that I could point her to. And since then, I have thought of that young woman 1,000 times. I don't remember her name. I only remember that someone in my home state was suffering and was afraid when all they wanted to do was to care for their family and to contribute to their community. But instead, she was living with the constant fear that her ability to do both could abruptly end. Expanding Medicaid is about doing something. It's about doing something that is very important, that makes a very big difference for people like her and others. Because as the research clearly shows, when states expand Medicaid, individuals are healthier, communities are economically stronger, and the health systems that serve all of us can be even better. Let me give you just an example about the impact that Medicaid expansion has in those three areas. And these are just simply illustrations. Earl talked in passing about COVID and the crush of COVID, and we have this crush not just today, but for the foreseeable future. And we all know that insurance coverage is helping to offset the cost of COVID, to help to prevent it, to help to treat it, and that coverage is essential. In North Dakota, I can tell you that our own state Medicaid director said that in March of last year, March of 2020, we had in North Dakota about 21,100 people with insurance through Medicaid expansion. And do you know what that number is today? Well, as of just a couple of months ago, that number of people covered by Medicaid expansion in North Dakota has gone up. We are at about 22,700 North Dakotans getting their health insurance coverage through Medicaid expansion. What has likely triggered this increase? Well, what's likely triggered this increase of over 1,700 people, now additional individuals on Medicaid? Most likely, it's COVID-19. So access to health insurance coverage is all about COVID for sure. And it's also about getting access to timely, preventive screenings and treatment of other diseases as well. Medicaid expansion makes a difference for illnesses. I'll give you a simple example. And it's about one fairly common illness, unfortunately, not about COVID, which has become so common today, but about another relatively common disease that many of you will know people affected by, and that's cancer. Using cancer as an example, research is really clear that the impact of cancer is different for individuals in states that have expanded Medicaid, like North Dakota, versus states like South Dakota that have not. Let me tell you what I mean. In states that have expanded Medicaid, here's what happens. Cancer diagnoses are being done earlier in the disease process. In states that have not expanded Medicaid, cancer diagnoses are on average not made until the disease is further along. Why the difference? Well, very likely the major reason is because what we know is that people delay access to care, including preventive health screenings. They delay access to care because of cost. So if you don't have insurance coverage and you might be faced with hundreds, maybe thousands of dollars in bills, you're less likely to seek out healthcare when you need it. Medicaid expansion, of course, takes a lot of that cost off the table. But when it comes to something like cancer, you do not have to be a nurse or a doctor to know the difference that a diagnosis that's made early can mean for somebody's survival. Let me say a word about the second difference that Medicaid makes, and that's not just on individuals and how healthy they may or not be, but it's on the economic health of communities, regions, and states. 2 years ago, when the North Dakota legislature met, and the North Dakota Hospital Association talked to the legislature, and I'm guessing they probably talked to the business community too, because what they were talking about was the positive economic impact on the state of having expanded Medicaid and the importance of continuing that. For North Dakota, the North Dakota Hospital Association pointed out that the economic impact to North Dakota was over $540 million. That's not chump change. So my third and last point, an illustration that I want to share with you, Medicaid expansion and its impact on the financial health of the healthcare system in our states. The roughly 47 hospitals in North Dakota, all of them added their names to supporting continuing Medicaid expansion coverage in this state in the last legislative session. Why did they do it? Well, there were a number of reasons. I'll share just 2 or 3. First, here's what we know. Across the United States, most small rural hospitals, including here in North Dakota, by the way, most of them have very thin margins to operate on. There's just not a lot of money sloshing around in these facilities. Today in North Dakota, our smallest rural hospitals, critical access hospitals, like hospitals in South Dakota, you've got them too. But here in North Dakota, collectively, our small rural hospitals get about $25 to $26 million a year as a result of the state having expanded Medicaid. In North Dakota, for our small hospitals, that's pretty significant money. In fact, our state hospitals have pointed out that without Medicaid expansion, there would be an increased likelihood of hospital and clinic closures in rural areas of our state. And that is not some overstatement. Across the nation, in fact, there have been over 130 rural hospitals over the past 10 years with double-digit closures occurring in just the past 2 years. So over 130 hospitals closing across the US in the last 10 years. But the last 2 years, double-digit hospital closures each year. And do you know where the majority of those hospitals are closing? Over 70% of those rural hospitals are closing in states that have not expanded Medicaid. So all of a sudden, you have not just uninsured people without access to care, you have entire communities without access to care. And in terms of economic impact, with hospital closures comes loss of healthcare jobs, really important lifeline in those rural communities for the economy of the community and for the health of the community. It's interesting because our State Hospital Association also pointed out that without Medicaid expansion, fewer healthcare services could be available. Fewer healthcare services, not just for some, but for everyone in communities. You might ask, well, why would that be the case? It's because, for example, that when a hospital has a lot of people coming through their door, people who are unable to pay for their bills, that is, they get care and they're unable to pay for it, and that hospital is providing that care goes uncompensated. That hospital, in other words, absorbs those costs. They're left holding the bill when a patient without coverage cannot pay. So the hospital has fewer dollars to put into other things, like buying a new piece of equipment that everyone in a community could benefit from, or starting a new diabetes program that people with diabetes could benefit from. In other words, the impact of not having health insurance coverage for thousands of people certainly affects those individuals, but the ripple effect, it is much broader than that. So it's no surprise that our North Dakota Rural Health Association also supports Medicaid expansion. And just to put a fine point on it, research was released just this month, just within the last week, a major health journal, highly recognized in terms of the quality of the studies that it produces. This journal released research earlier this month that shows that in states that expanded Medicaid, all hospital types, large and small, financially benefit. And the researchers pointed out that given the huge, huge financial hit that many hospitals are taking under COVID-19, now Medicaid expansion, it could be an even more important source of revenue for hospitals, large and small. With that, I'll stop and I'll turn it back over to Adam. Thanks again so much for being with us tonight.